Welcome to Summertime Harder to Breathe. I'm your host, Ryan Dusick, laid back.
I feel overdressed.
Well, this is me in the summertime, man.
Wow.
Ryan Dusick, I was the founding drummer of Maroon 5, but now I'm just a chill licensed therapist.
Bro.
An author, mental health advocate. You know, and on today's episode, man, we got this really cool sleep doctor. His name is Dr. Michael Breus. Can't wait to have a conversation with him.
I'm Duck Maillard. Hey, and I feel chill too because your chill vibe is making me feel chill. What's going on with the sunglasses?
You know,
did I miss a memo?
This is just my new look, man. It's summertime. This is the way that I hang, man.
I like it. Lean into it. Spectacular.
No, honestly, there is a story to the sunglasses, and I'm not doing my Stevie Wonder impression while I talk about it, although I did kind of lean into it.
That's true.
A little bit. No, I'm going to take off my sunglasses. I'm not chill. That's the real answer.
It's true.
I'm pretending I am, but I have an eye thing, which is improving. It's getting better. I was debating whether or not to wear contacts or to wear glasses again to obscure it. In last week's episode, it was there, but I wore glasses. I don't know if you could really tell. It's just
What is it, just like a sty? Yeah.
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 But, you know, I'm vain.
Yeah, sure.
So I considered wearing the sunglasses the whole thing, but I was like, that's going to look really ridiculous in the clips.
Like
with no context, no explanation.
Yeah, we're just totally changing the vibe. We're just totally Hollywood.
So how you doing, man?
I'm good. I'm excited to talk about our sleep doctor today because sleep is a thing that we never discuss. We never talk about the importance of sleep health and all that stuff. And I'm excited. Is sleep important to you? Are you a good sleeper?
Oh my God, man. Sleep. I have a long history with sleep, and I've never really conquered the whole topic of sleep in my life. It's something I talk about a lot with my clients and in terms of the importance of sleep. And it's not lost on me how important it is for me and how much when I feel rested, I feel so much better in every way. But it is a challenge. I've made it a priority in my life, but it's still something that causes me a lot of consternation trying to get enough sleep on a daily and weekly basis. I have a long history with it. I mean, it's weird. It's kind of morphed over time. Like the challenges I had with sleep when I was younger are different than the ones that I have now. And I've just kind of tried to devise a lifestyle that allows me to somehow cobble together enough sleep. But I want to talk to the doctor about it because this is a great opportunity to get some, free advice.
Right, yeah. I've actually become a better sleeper as I've gotten older. When I was younger, I had a lot of trouble falling asleep. I think it's one of the reasons I used to stay up so late was just because I wanted to exhaust myself. So the minute I'd hit the pillow, I'd finally just fall asleep. Because I used to lie in bed for like an hour when I was a kid. And thinking back, I think there might be more to it than just like, I can't sleep. It's like I would hear my parents fighting, or I'd be, racing through the memories of the day, and my mind would be, racing thoughts, things like that. So I too would like to pick his brain a little bit. We both took, the doctor has a cool sleep quiz on his website that kind of lets you check for your sleep health, and we both took it. So it'll be interesting to hear what the doctor's assessment of our, the answers to his test is.
Well, it's interesting that you talk about the things that affected your sleep as a kid and that it's improved for you, because I would think that would be something that would continue into adulthood.
Yeah.
I look back on when I first started having problems with sleep, it had a lot to do with my school schedule, going to Brentwood High School, which was on the other side of town from where I lived, and there was a lot of traffic going to and from school, and I had to get up really early because we had to carpool, and I would just be tired all day and then get a second wind at the end of the night when my parents went to sleep. Because as a teenager, I feel like I was always kind of like having to go and try to keep up with the expectations of the day. And then that time when my parents would go to sleep, that was like the one time that was for me.
Yeah.
And so I would want to stay up and watch like Showtime and Cinemax.
Now we get to the crux of it.
But also just talk on the phone with my friends or like just feel like there was no pretense. It was just whatever I wanted to do or feel in that moment, and not have to show up in some way that my school or my, the authorities in my life expected me to show up. And so I associated nighttime with a good time. And then it became, I'd stay up late and then I had to get up so early for carpool that I would just be exhausted all day. And for the longest time, I thought I was a night owl for that reason. I mean, I was a musician, and on tour, you never can get to sleep early. For the first half of my my adulthood, I was just basically staying up all night and sleeping. I was like a vampire.
Yeah, you and I had some late nights in the days when you were producing and managing my band. I remember some 4 a.m., 5 a.m. nights, we'd be up and recording, or we'd just be jamming at your house, and then the sun started to come up and it's time to go.
For sure. That was my lifestyle in general, especially when I was drinking, I would stay up but that stayed the case for you, right? If you have your druthers, you like to stay up.
Yeah. And again, I think part of it was the initial difficulty getting to sleep when I was younger. And then when I got older and I was allowed to stay up, especially in college, I would stay up specifically because I wanted to be a part of the party. I wanted to be, the guy who was like, hey, I'm up for anything. So I was always the last to fall asleep. Like in our house that we lived in, I took the bedroom downstairs right next to the living room because I was like, I'll definitely be the last. No one's going to keep me up partying, and I think there was that FOMO, that fear of missing out on those social opportunities because I didn't have as much when I was younger. I was kind of isolated and I didn't have friends that lived nearby. And so I didn't have a lot of sleepovers and stuff. So when I started experiencing like, hey, it's 2 a.m. and the party's still going, and I don't even mean party in terms of, drugs and alcohol, obviously, but just socially, I loved it. I loved having people at my home and so even now I stay up. I haven't been to bed before 1 a.m. in years. I mean, it's like 1 a.m. is early for me. I'm like a 2:30, 3 a.m. guy. And I have been forcing myself to get up earlier and earlier now, especially when we have these recording sessions at 10 a.m., which is like 6 a.m. to most people. So yeah, it's still there in me. But in recent months, it's gotten a little harder just because with school and stuff, I try to get up and help my son and stuff. So I'm getting fewer hours than I probably could use.
Right. Well, you actually remind me of a really positive memory from college, a kind of a romantic thing. I remember because I was a night owl and I would stay up past when my parents went to sleep when I was in high school. And because I wanted to continue that, I scheduled all my classes when I could after like 11 or 12.
Oh yeah, totally. Totally. My senior year was like nothing before noon. It was great.
Yeah. And so, but I remember one night, like the first time I ever stayed up all night until the sun came up. And I was just with a friend of mine in my dorm and we were just like talking all night and we're like, holy shit, the sun's coming up. And we watched the sunrise. And it was like this, I don't know, the feeling was sort of like freedom. And like, this is like a coming of age moment where it was like, I get to make decisions about my life now. I can stay up until the sun comes up. It was like
you'd pay for it the next day, but it didn't matter in the moment.
Yeah, exactly. And then I remember a lot of nights where I would wait until like 2 a.m. to start writing a paper and then write it and then turn it in at 8 a.m. and then go to sleep after that.
Right. Yeah. Like I said, I always felt I did my best creative work in those, 11 p.m. to 2 a.m. hours, which is, as a musician or as an actor, that's when you are. If you're doing a show, it starts at 8 p.m. and you come off stage at 10:30 and you're like, I'm jazzed, I'm hyped, So
I feel like that was kind of a fallacy to a certain extent because being in a band, you rarely roll in, at least when this is 20 plus years ago, but you'd rarely roll into the recording studio before noon. Yeah. And you probably wouldn't press record until 2 or 3 at the earliest. And then the feeling is you do your best work after midnight, when the world has gone to sleep and you're like, just really feeling the vibes.
Everything else is faded away and yeah.
Yeah, and you dim the lights down low and you burn some incense and then you really make some good music. Right. But I don't know if that's really true. I think that's maybe a fallacy that us creative people tell ourselves. It's like, because it feels magical. It feels like this is the witching hour. This is when the magic happens. But it's like, did the best recordings actually happen then, or did the best vibes happen then?
Sure. Yeah, we know that the Beatles would bang out 3 songs before lunch and then come back and 2 songs before tea, and then they'd be done at 5 p.m. with the guys in their ties and stuff. So who knows?
Right. Yeah. Well, anyway, just to get into some of this stuff with our guest today will be interesting because sleep is, I know how important it is, but it is a conundrum at times in terms of how to.
Indeed.
So I wanted to talk to you a little bit more about our episode last week. We've decided, as you know, and I don't know if our audience knows, that we actually have a much closer, the relationship of when we record these things to when they're released is much closer now, right?
Yeah.
And so this episode, we're just recording, it's going to come out in maybe 2 weeks or a week and a half. And we just recorded the one that's coming out next week, which was our political episode, our sort of quarterly check-in that turned into a political episode. So it's still fresh on my mind. And when this episode airs, it will have just aired.
And hopefully will be very fresh in the minds of our listeners.
Yeah, exactly. I hope so. Or maybe that's the reason why I'm raising it again, because I have continued anxiety about that reality. And I mentioned it while we were talking about how we were both stressed going into the idea of talking about politics overtly. We've brushed on the topic before, but never like overtly talked about it. And we had a conversation the other morning when we were playing softball. I was like debating, should we put this thing out? Like, I don't know. I felt very conflicted about it because when we were recording it, I could feel a lot of emotions that I wasn't necessarily voicing. And I felt as a result, I wasn't as effective in communicating as I had hoped I would be. And then on top of that, I wasn't really saying what I was feeling. And this being a mental health podcast and us wanting and talk about our feelings, because that's what we do on this show more so than any other show that might just talk about politics in a very dry way or a very
fact-based or something.
We have to bridge that gap. And what I thought you did a really good job about was really wearing your heart on your sleeve, which is not hard for you to do. That's your nature.
True.
But I felt your frustration. I felt when you were talking about it, and when I would say something that was just a sort of general argument about politics, you would have an emotional reaction to it. And I felt like I was not prepared to meet that. I wasn't prepared to like let that out of myself. And so I want to share right now, because we're in close enough proximity to that episode, that I was feeling anxious while we were recording it, and listening to it back, I could tell like my voice was getting higher in pitch as we were talking about it. And I was feeling a little nervous and scared of like saying the wrong thing, and just feeling like, I guess a little bit of imposter syndrome for the first time in a long time. Because I've talked about this stuff a lot with you or with friends. Obviously politics comes up. I talk to my dad about this stuff all the time, and I feel like I have pretty well-informed opinions. But it's different when you're like, okay, the world's going to hear this now. Right. And this isn't just in that moment, or like realizing this isn't my thing. Like I'm not an expert on this. I haven't ever done this before. Now to do that, you have to start somewhere. You have to just start talking about it. But I felt like it was so broad, and we were trying to tackle all of the topics of politics in 1 hour.
It might have been a bigger bite than we were prepared to chew.
Yeah, and I wanted to get into more specifics, but every time we would touch on a new topic, like it was so overwhelming in that same way that when you turn on the news and you see everything that's going on every day in this rapid news cycle and the drinking from the fire hose of the Trump chaos. Just like, where do you even start? Like, I want to say this, I want to say that, and I have this point about that, but it all kind of got clouded together in my mind. And so my anxiety kept rising, and I felt like I was getting more and more flustered as I was trying to address it. And I feel like I've been feeling that in general. I know people have been feeling that because of the nature of our politics and our news cycle, but it was just a different experience in trying to verbalize it in the way that we were. And again, I decided to put it out. We haven't discussed this actually. I'm telling you now.
Breaking
decided
news.
to put
We're putting it out. Yes.
It's obviously out already when this airs. But I just decided to have them edit it and put it out because I feel like I said, you do have to start somewhere. And if we're going to get into more specific conversations, we have to kind of start with some ground base of like where we stand and what our angles are on this. And I feel like I do have a little bit better understanding of where your values lie, where your emotional investments are in terms of how we're going to communicate and talk about these things. I don't know if I did a good job of really representing my feelings about certain things, but I tried to kind of like just create a context, I guess. So hopefully I achieved that. I don't know how it's perceived by you or by the audience that listened to it, but I feel still self-conscious about it, I guess is what I'm saying.
Well, first of all, thank you for sharing that. And I'm sorry that in the moment if I was oblivious to that or something, but
no.
Personally, I feel and felt then, and even thinking about it now, that I think it was fantastic for that reason. Because, we've talked about the dynamic on this show is that I might be the guy that's like, I don't understand how this works. And you're going to be like, well, let me explain and you're the expert, I'm the layperson. And when it comes to things that we are both sort of layperson at in politics, it allows you to kind of take off that therapist mask a little bit and be a little more emotional. That being said, I still feel like you were the person that was like, let's bring the temperature down a little bit. Let me explain what's happening to you right now in these moments, Duck, when you're feeling so rageful that you want, I did that multiple times. You were able to put that therapist hat on for that moment and then go back into your own emotional thing. So I think it was a great peek behind the curtain hybrid of what our roles normally are on this show, where not that we swapped roles, but we came a little bit to the dark side of emotion. But also this conversation as a companion piece to that, it allows our audience to see you are not, and anyone who comes on shows like these and just espouses facts as if they were absolute truth, sometimes it's opinion, it's a great reminder that like, we're just all doing our best, whether we're trying to do this as a show, whether we're having a conversation in private where maybe I don't have all the facts right, but the emotion is there and that's what is important. That's what was important in that conversation last week. It's not whether or not we could come up with the name of the Speaker of the House off the top of our head and talk about legislation. That wasn't the point. The point was how it makes us feel and how it's affecting our mental health. And for you to struggle with that as much as you feel you did is a great indicator of how much it affects all of us in different ways. So I think it's honest and true. And even with your concerns, I still think you were eloquent and a lot more put together and you know, than I was in those moments, because I just go, and you go, let's talk about it. So
well, I
personally,
appreciate that.
I loved it. I thought it was great.
Thank you. And yeah, I mean, I think that's my role. I have to be able to bridge the gap between, even if I'm talking about something, just an opinion about politics or something in our world, a social issue, bridging the gap in terms of mental health, in terms of this is relevant. And this conversation we're having now points that out, that it's relevant because this is something that is causing us all a lot of stress and brings up a lot of emotions. And we have to sort of wade through it however we can. We have to be able to talk about this stuff, even if it's uncomfortable. That's kind of the takeaway. That's the main message that we were trying to drive home. I think for me, it was like, because I'm so used to on this show, and with my clients and when I speak about mental health, being sort of in the position of people are expecting me to be the expert or at least to have some authority on that. Like I was trying to occupy that space talking about something that I'm not necessarily the authority on. And I think that I hadn't really thought that through, because there were moments where I felt like I was kind of a little bit out over my skis, like trying to be something that I may be in the future, but this is the first time I've ever doing it. And so I felt like a pretender, like, oh yeah, I'm a talking head on CNN right now, going to tell you my thoughts on this political topic. And it's like, that's not really my place. I can share my opinion and we can talk about things and have a debate, but I'm more of the authority in terms of mental health and in terms of talking about the feelings, talking about how these things are affecting us and how we wade through these things in a more productive way. And I think there's gray area there in terms of how that crosses over to how we do that as a society. Yeah. But I think we were just kind of trying to figure out our footing in that first conversation.
But I also think it's relatable in the same way that, you know, especially, I mean, just the fact that things that led you into becoming a therapist were your own relatable struggles with anxiety, with substances, things like that. The same way someone who is, you know, maybe had an eating disorder, helping with eating disorders, things like that. It humanizes it. It's not just theory. It's not just clinical. It's experience. And so for you to be emotional and hear your voice get a little higher and get flustered and feel like maybe you don't know it just goes further to prove the point of, like you say, why those conversations are necessary. Someone who's a professional in that field can still be feeling the same things that the rest of us feel when we start to talk politics. It makes everyone else go, okay, I'm not overreacting. This guy's a pro and he's still feeling it. You know, it's like seeing a doctor come on and be like, I have a cold. Be like, they're human too. They catch colds. It's great. Right. So I think it's terrific. And I think it's why a conversation today is going to be great, because we have sleep issues and everyone, you know, could benefit from better sleep. And talking to this guy, maybe he's going to be like, I had sleep issues too. I don't know. We haven't had the conversation yet, but I'm excited to find out.
And that, ladies and gentlemen, is what you call a segue.
Boom.
All right, man. So Dr. Michael Breus, he is a clinical psychologist and sleep medicine expert. He was named top sleep specialist in California by Reader's Digest.
I didn't know there was a ranking.
That's a thing. Yeah. Apparently it's clocked.
Very competitive. Yeah.
Ranked. Yeah. He's the author of 5 books. He has a new one out. We'll ask him about that. And you know, it's just interesting for me to get into this stuff because, as we've said, you know, sleep is so important. So let's jump into this conversation with the sleep doctor, Dr. Michael Breus, right here on the Harder to Breathe podcast. Hi there, Dr. Breus.
Bruce.
Nice to meet you.
Like
Bruce.
Zeus.
Bruce. I apologize.
It's okay. Nobody gets it right.
Should I call you Dr. Bruce or should I call you Michael? Or
when you introduce me, call me Dr. Bruce, and then everything after that's Michael. It's fine.
Okay, great.
Well, hello. Nice to meet you. Thanks for coming on.
Oh, it's my pleasure. Good to meet you as well. Thanks for having me.
Did we already clarify if we were saying your name properly?
Yes, it's Dr. Bruce.
Oh,
it's Bruce like Zeus.
All right, so we're going to have to print a retraction in our intro.
Yeah, I apologize for the intro we just shot I called you Dr. Breus.
It happens every single day, so don't feel bad. You probably did a decent job. Most people are like Dr. Breus, Dr. Breus. Nobody seems to be able to get it right, so it's all good. It's all good.
We were also saying in the intro that it's very cool to have you on the show because both of us have had, some challenges with sleep in our lives.
Let's talk about them.
So I wonder, just first off, to get started, I know that sleep is very important, but you've made this your life. This is your specialty. You're an expert in this field. Why sleep? Why is it so important? And why did you make that the focus of what you do?
Well, it turns out those are two completely different answers. So why sleep is important and why I ended up as a sleep doctor couldn't be further from each other in terms of answers. So I'll answer the second question first. Why did I become a sleep doctor? It wasn't by choice. So I was originally trying to become a sports psychologist, and the program that I was trying to get into. So I was at the University of Georgia getting my PhD in clinical psychology, doing an emphasis on sports psychology. And at the end of your PhD, you go and you do what's called a residency program. So basically, you go practice all the shit you learned over the last 4 years for a year under somebody who's been doing it for like 20 years, so you basically don't screw anybody up, right? And you go to a place where they have different types of patients. And so sometimes people might go to a VA where there are people dealing with PTSD and, let's say, addiction issues and sleep issues, whereas some people might work at a college and deal with more collegiate mental health issues, things like that. So I wanted to go and do sports psychology issues, work with sports teams, have lots of fun, all that kind of cool stuff. Problem is that the best program in the country, which was the one I wanted to go to, wasn't particularly interested in the University of Georgia. They liked people from Harvard and Princeton and Yale, and there's nothing wrong with people from Harvard, Princeton, and Yale. But I went to Georgia, top 20 program, but it wasn't Harvard, Princeton, or Yale. However, they had a side track in sleep that you could apply for that was outside of the program. They were looking basically for somebody who had an interest. They'd be willing to fund them for the year. And I was like, hey, how tough could this be? I worked my way through graduate school in the electrophysiology department. So I'm the weird guy that likes to take apart EKG machines and put them back together. So it turns out that the machines they use for sleep are identical to the machines that we were using in the electrophysiology department. So I was like, this is going to be easy. I'm just going to sell myself as a sleep guy. And then as soon as I get there, I'll just transfer, right? Because, if you're not going to let me in through the front door, well, that's on you, just brother. Right. I'm still going to make it into your system. And so I sold myself as a sleep guy. Day one, I raised my hand. They said, yes, Dr. Breus. I said, yeah, hey, I want to know about transferring. I want to get over into that sports psych side of things. They said, we had a feeling that you would want to do this. So here's the deal. You're funded by the sleep laboratory, which means you must participate at the sleep laboratory for 6 out of the 12 months that you're here because they're paying your rent. I was like, okay, then what? They said, then after that, you can go to any part of our program that you want. I'm like, oh, how tough can this be? It's sleep, for God's sakes. You go in, you close your eyes, you come back out,
Get
right?
Some suction cups stuck to your head. It's
right.
easy.
Come on. How tough could it be? Right. And so by the third day, I absolutely fell in love with clinical sleep medicine, and I knew I would never go back to sports psychology. And the basics are, I help people this fast. It's unfucking believable. When you don't sleep and you fix somebody's sleep, you change their life. It's demonstrable. You both had mentioned that you had sleep-related issues. My guess is if you had those issues fixed, it was life-changing. And that's kind of cool. There's just not that much stuff that you can do in the wonderful world of psychology that, number one, works quickly, and number two, works so effectively, right? When I was learning about depression and things like that, it could take weeks, months, even years to see any kind of treatment gains. I can change somebody's life in under 24 hours. Wow. It's unbelievable. So that was how I ended up as a sleep doctor. It really wasn't this, oh my God, I've got such a passion and I want to teach people about sleep. It wasn't, I've got a sleep problem myself or somebody that I care about does. It was really very serendipitous. I literally fell into the residency and just really enjoyed it and have been doing it basically ever since. Now, I will tell you that I've been doing this for 26 years as an actively practicing clinician. And so I have definitely grown to love the space, and I think my initial reasons for getting in the space have evolved over time. And here's what I can tell you. Sleep is arguably the most basic bottom line function that our body does other than breathing and drinking water. And so if we don't get that right, there's no universe that anything else is going to go particularly well in our bodies. And so for me, I like being at the ground level. Like I like being at the most basic aspect of things because if I'm being honest with you, it's not that hard to fix sleep problems. Like honestly, it's really not. And so once we start to get people understanding some of the basic concepts around sleep and fixing their own sleep problems, like my guess is we're going to have a better world. And like right about now, we could really use a better world.
Absolutely.
Okay. So for me, my purpose or my goal or what I'm trying to accomplish these days is I'm trying to help people who help the world, and I'm trying to help them sleep better because the way I figure is if I help people who are big influencers who've got podcasts like you gentlemen and who are out there, influencing people, if I can teach you about sleep and then you can proselytize and get the word out there, you know what? We get more people sleeping. And then here's what would be cool. What if everybody had a good night's sleep? Like, what if everybody had a good night's sleep on the same night? Could you imagine what would happen the next day?
Day would be like historic.
Yeah. I'm pretty sure world peace happens the next day, right? Because everybody's like, hey, I feel pretty good. Hey, you feel pretty. Hey, what are we arguing about? Let's figure this shit out. And all of a sudden we're there. So, I mean, I know it's a simplistic idea, but there is real value there. And here's what I can tell you. Every sitting president, the second they leave the office, the very first thing they talk about is how much sleep they lost. Yeah. Very first thing. Every single sitting president. And I've spoken to several. And they all say the same thing. Like, that is the job where you don't sleep. And that is not the job where you don't want to sleep.
Right.
Absolutely, and amen to the fact that we would live in a better world if everyone was well rested. I mean, the difference for me individually on days when I feel like I've caught up on sleep and I feel well rested, I do everything better. Yeah. I feel better. I enjoy and appreciate my life better. My ability, my patience, my capacity to understand other human beings and to respond in a productive way goes way up. Yeah. And I see this in my clients, and it's one of those things where it's like a chicken or the egg thing, where it's like your depression would go away, your anxiety would go away, your relationship issues would improve if you just slept more. But then it's like
I can't sleep because I'm depressed.
The reason why I can't sleep is because I'm anxious or because I'm stressed out. So how do you deal with that?
I want to double tap on one thing that you just said, which is I want to make a small possible correction, which is it's not about how much you slept, it's about how well you slept.
Right.
Right. Mm-hmm. So it's not just a quantity issue, it's also a quality issue. But I think people have a hard time distinguishing between the two. People just say, hey, I got my 7 hours or I got my 8 hours. I'm going to be honest with you guys. If you get 8 shitty hours, it doesn't matter. Like, it's not good, right? I'd rather you get 6 hours of super high quality sleep than 8 hours of super crappy sleep, right? But Ryan, I will also tell you that you nailed it, because one of the biggest problems is this washing machine, chicken and egg, which came first, my sleep problems or my depression and anxiety, which are now fueling my sleep problems and my depression and anxiety. And we're just going like this, right? On and on and on. It's kind of like this weird washing machine. I mean, I'm glad you brought this up, because I fundamentally believe that most sleep problems are fear-based. Okay. So let me explain. Even the biological ones like sleep apnea, believe it or not, right? So think about it like this. When you're asleep, you are the most vulnerable you can possibly be, right? Your eyes are closed, it's dark, and you are a target, right? If you do not feel safe, you don't sleep, right? I think that's fundamental. I think that's evolutionary, right? I think that's locked and loaded into our Neolithic brain, right? If I'm not safe, I don't sleep. Okay, so now let's talk about safety. Safety comes in lots of flavors, right? And being unsafe comes in lots of flavors, right? And I'm not just talking about physical safety here. What about financial safety? What about relationship safety? What about spiritual safety? What about like all of these things? Like if you're having an existential crisis in your head, newsflash, you ain't gonna sleep. right? Like that is just how this system works, right? And so what we have to do is we have to teach people a little bit of biology, like, okay, what is an autonomic nervous system? What's the parasympathetic? What's the sympathetic? How do those work? How can I learn how to control those better? And then how can I use that control to allow me to get a better night's sleep? I'm here to tell you, boys, that sleep is achievable. Okay, I have not met a single patient yet, I've done this for 26 years, that we couldn't figure out a way to get them to sleep. Now, to be clear, some of them require medication. That is not necessarily a terrible thing. I want to be very, very clear here. There's no pill shaming going on here. Good. If any of the listeners today are taking something to help them sleep and that was prescribed by your doctor, I want to be very clear. That's okay. All right. That is a relationship between you and your doctor. Right. And if you have a situation that is going to require that, then by all means, you should utilize the technology that's appropriate to use. Right. The problem comes is when people get stuck on something for long periods of time. Right. And this, by the way, happens quite frequently. I get people who show up on my doorstep and they're like, Michael, I've been taking Ambien for 15 years. What do I do? Right. And so that is a different situation. That is a situation where somebody comes to me and then here's what we do. We reach out to their prescribing doctor and we say, hey, this patient's not as comfortable as they once were being on this medication. What is your comfort level of us creating a taper schedule so we slowly taper them down? Meanwhile, I'm going to teach them some skills called cognitive behavioral therapy, right? That's going to give them some stuff to teach them how to sleep on their own. So that way, when the pills are going down, the therapeutic intervention is going up, and then the patient goes up instead of down, and we get there. Now,
and there's still, sorry to interrupt you, but there's still, there's fear there as well that they're not going to be able to sleep without the pills that they've been using for 15 years. So they're like, well, I'd rather get shitty sleep on Ambien than no sleep on nothing.
So that's the most egregious part of the whole thing is when you talk to somebody and I turn to them and I say, what are you doing? And they say, I'm taking an Ambien to fall asleep. I'm taking a second one in the middle of the night. I'm only sleeping for 4 hours. And I'm like, it's clearly not working. Why are you continuing to do this? And here's what they say, Duck. Can you imagine how bad my sleep would be if I didn't?
Exactly.
Mm-hmm. Right? Mm-hmm. And so there's this built-in fear factor, which, by the way, is incorrect. Okay, like now to be clear, if you rip a pill out from under somebody, they ain't going to sleep for about 3 days. Okay, that there's a rebound insomnia. There's a highly physiological portion to that problem of having something on board for long periods of time and then removing it quickly versus a taper schedule. I should have defined what taper is for the listening audience. Taper is where we take the dosage and we lower it incrementally over time, so that way people don't get any withdrawal effects from the medication, right? Sleep medication in particular can be very damaging because when you just rip it out from under somebody, it's historically known 3 days. People are awake usually for 3 days. By day 3, they are freaking out. They're like, I don't know why I'm not sleeping. And then the paranoia hits in. And then because they're sleep deprived, the whole thing goes downhill. So back to the basic question, which was, why is sleep important? What's going on with sleep? How am I looking at it these days? Here's what I would tell you is sleep is flexible, right? So people don't need to lock and load on, I have to get 8 hours. People don't need to lock and load on, nobody should take a sleep aid. People need to understand that sleep is individual. However, I can assure you, I can get almost anybody to sleep, almost anybody without a pill. Again, certain situations being what they are. If you're a paranoid schizophrenic, you get Ambien, okay? That's just how it works, right? But if you're not, and you're not comfortable on that, then let's figure out a way to get you comfortable. And to be clear, sleep is a biological function. There's no requirement for an additional supplement or medication to make it occur, like breathing or hydration, right? That this is something that the body does.
So let's go ahead and use me as sort of the guinea pig here.
I can't wait.
I've been looking forward to this because I've been contemplating, like, do I need to go to a sleep specialist? This is something I've struggled with for a long time. And, you know, I went onto your website, I took the sleep quiz, and it was interesting because you're trying to figure out, like, what kind of a sleeper am I?
Correct.
For me, it's been complicated because my sleep problems have actually evolved over time. And
Can I guess at what your sleep animal might be?
Sure.
I think you're a dolphin.
Yep. Okay, so should I give you like the brief history?
Yeah.
We'll bring it up. Okay, so I started having problems as a teenager. I was talking about a little bit in the intro. You know, just I had a lot going on in high school, and by the time I had to get up very early to go to school, there was carpool, and then it was a lot of work. It was a very like high performance type of environment. I was on the baseball.
Were you in athletics as well as academics?
I was a baseball player. I wouldn't get home until like 7 o'clock at night because of baseball practice. I was not in a good place. You talk about an existential crisis. If you're having an existential crisis, you're not going to be able to sleep. My first existential crisis was around this time. So that gives you an idea. And I'm a thinker. I'm an overthinker. By the time it was like I had done my homework and everything I needed to do in the evening, that's when all of a sudden I would feel most awake.
Right.
My brain would be most active. I wanted to either talk on the phone with my friends or like watch a movie or whatever it was. And when I'd put my head down to sleep, I couldn't go to sleep, even though I'd only slept 5 hours the night before, and I would only get 5 hours that night, and it would add up over the week, and I would fall asleep like in my car on the way home from school, or like, I would ditch class to go take a nap in the theater.
Did you fall asleep a lot in first period?
I wasn't really one to just fall asleep like sitting in class, but I started ditching first period just so I could go lay down on the couch in the theater.
I get it.
So then I became a night owl by nature for many years, and I was a musician and on tour. You're up late, and I just always thought, this is my clock. As long as I can sleep in, this works. So that would be a different animal, I think, on the
that would be a wolf
quiz. A wolf, right? Exactly. But then all of a sudden, 2016, I quit drinking. I get on the path of recovery. And in rehab, I started going to sleep early, getting up with the sun. And I was like, let me just maintain this. This feels healthier, right? And
how old were you when you were in rehab, if you don't mind me asking, Ryan?
I was 38 years old.
Okay, got it.
And I had been literally for years before that staying up all night and sleeping until the afternoon.
Can I ask a couple more quick questions?
Please.
What was your substance of choice?
Alcohol.
Okay.
And to a certain extent, benzos, but alcohol was number one.
Got it. And would you drink yourself to sleep most nights?
Many nights, yes.
So a couple things just for the audience to know. So I'm going to tap out and then tap back in, right?
Yeah.
So I'm going to tap out just so that the audience can we're going to break the fourth wall, or I guess that's what it's called. So first of all, your behavior of wanting to be a night owl as an adolescent, perfectly on par. All adolescents want to stay up until 2 and sleep until 12. It's something about their circadian rhythms have a tendency to shift late. However, what I also know is with my artistic people, which I think you are one of those, we also know that those people have a tendency to be night owls as well. That's where I find my actors, my artists, my musicians, my poets, my writers, all of the, who gets inspiration at 2 o'clock in the afternoon? Nobody. Right? Everybody gets inspiration at 2 o'clock in the evening time. And so that becomes very, very interesting. Now, here's where it gets even more fascinating. And I think potentially with your story, Ryan, which is when you're a night owl and you're doing gigs at night and you're doing all that stuff at night, your body is primed to be awake at 2 o'clock in the morning. And so literally the only substance that is readily available, that is easy to access, that will move you in the opposite direction is called alcohol. Okay. Like that is, it's just like, especially when you're gigging, like if you're out at the bars and you're doing stuff and you're an artist or what have you, like, guess what? Everybody wants to buy drinks for everybody at, in the band and blah, blah, blah. And what people don't realize, I work with a bunch of musicians, is the amount of energy that you have after a show is almost more than before the show. Yeah. And so many people don't understand that. And so you were looking for a way to artificially turn that volume down because it was already 3 o'clock in the morning. You're like, holy shit, I need to sleep, or I need to go to work the next day, or things like that. So the pathway that you took, extremely common for what you're telling me so far. So please continue.
Very accurate. And even when I came home from tour and I wasn't even performing, I would try to have like a normal schedule. I'd try to get to bed earlier, and then I'd be laying in bed at midnight, and all of a sudden all of this adrenaline would peak, and I would start feeling like, oh no, this is the time when I'm supposed to be on stage or performing.
Exactly.
And so I'd have to like go for a walk around the block and try to calm myself down. And it just ended up with me, of course, going to the kitchen and getting a drink,
And just to be clear, it works, right? Like, let's be clear, alcohol works. Like, if you drink enough of it, you will slow down. Like, there's no fucking, I mean, that's just how it is, right? And so that brings down, the problem is that alcohol basically destroys stage 3-4 sleep, which is kind of your physical restorative sleep. It also has effects on REM sleep. In fact, it increases REM sleep at the beginning of the night and then decreases REM sleep in the latter part of the night. And for creatives like you, Ryan, that's not great, because that's where you get all your creative ideas and juices from, is from REM sleep. And so one of my guess is when you went into rehab, and this is just a guess, is after you got into rehab and you kind of dried out and cleaned up, the ideas probably started flying into your head, because now all of a sudden you're getting better sleep. You're waking up, like Paul McCartney woke up and wrote yesterday because of something that he dreamed about. Like, that's what I see happening in my artists, especially when they remove the alcohol as the stimulus. All of a sudden, all of that backed up creativity kind of kicks into gear.
Yeah, it was really interesting. For years, I always thought I needed the alcohol in order to be creative. And I realized it was completely blocking me from my creativity. And I felt so much more clear-headed and so much more productive and creative once I got that. It took a while. I mean, I was coming off of alcohol, and then I was weaning off of benzos. And so I was not sleeping much for the first month or so.
That's no joke. I'm surprised you slept it all for the first 3 months. Like, coming off of benzos is hard. Like, for folks out there, I mean, it's worthwhile to just quickly tap on that, which is some of the sleeping pills that are out there are addictive. Like, let's be very, very clear. Benzodiazepines are a drug class that's primarily for anxiety, and you are almost assuredly get addicted to most benzos. Like, I don't know very many people that don't. And so what happens is the doctor gives you medication for your anxiety, and then all of a sudden you use it a little bit more because you got a little bit more anxiety, and then all of a sudden, bing, 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 you've scaled up in dosage. Now you're in a really bad spot because you try to yank those and you will be up for 4 or 5 days. It becomes highly problematic. And then when you mix it with alcohol, it becomes an even bigger issue.
I sometimes wonder if I'm still dealing with the aftermath of that in terms of my struggles with sleep today.
How long have you been clean?
9 years.
So I would argue you're probably at the tail end of any of the damage that you were doing, depending on how heavy a use you were and what you were doing. We can talk about that offline. You probably don't want to tell the world about that. But
well, I wrote a book about it, so it's pretty much out there.
Okay, so if it's already out there, it's already out there. Yeah. But you know what I'm saying? Like, my guess is, depending upon the amount and frequency of your use, we kind of look at something like that on the opposite side of things. You look pretty young to have done a lot of damage, but you know, rock and rollers are rock and rollers. I will tell you the funny story is I work with a bunch of people. I won't say who, but one of my first questions when I get into the room and the whole band is there and I'm like, who's doing an 8-ball before the show? It's literally the first thing I ask, and everybody gets silent. And I'm like, look, I need to know exactly what's going in so then I can help manage what is going to happen. So let's have a very clear conversation here about what's going on. And here's what's always interesting is about half of the musicians are actually very health conscious. And they're like, you know what? I want my shelf life to continue. So I'm not doing any of that stuff. And then you've got the people who are kind of newer to the industry. Those are the partiers. Yeah. And those are the ones that it's kind of like rookies in sports. You know, it's like the rookie is the one who makes all the stupid mistakes, whereas the veteran is the one who's like, I want to stay in the league as long as possible. Yeah. Right. And so that kind of happens in the entertainment industry as well.
Yeah, I noticed that as well when we first started touring. The ones the bigger acts that we opened for that had been around for a decade plus, the Sheryl Crows and the Matchbox 20s and Counting Crows, and they all seemed like they had their shit together to me. I was like, oh, I was expecting these people to be rock stars. And they're like, you know, they've got their kids backstage, they've got their nannies, they're like going home and getting a good night rest. And it's the kids like us that were like, hey, let's party, man. Like,
yeah, it's totally different.
Yeah. So I think, you know, what was challenging for me was that, you know, the first time I was introduced to a benzo, I remember taking maybe Xanax, like on an airplane, somebody handed me a Xanax and I felt more comfortable in my skin than I had ever felt. Like I just kind of melted into my seat and I never was able to sleep on a plane before. And it was the first time I was like, and I got some restful sleep and I was able to perform that night and it was amazing. And so fast forward a couple of years to when I was really struggling, you know, a doctor, they gave me every kind of sleeping pill. Ambien didn't work, Sonata, all the different things. And then finally they gave me a benzo, which was, I think, called Restoril.
Yep.
And that was the best sleep I ever got in my life.
That you
and
fell in love, basically.
Oh, yeah. And after like 30 days of it, when I ran out of my first prescription, I tried to just stop. And I felt like I literally had been hit by a train. I felt like I couldn't understand what was happening to my body, and I couldn't sleep, like as you described, for days. And I feel like ever since then, it's like whatever I try, whether it's a substance or it's, all of the things we know to be good sleep hygiene, it's like, it ain't a benzo.
You're chasing that dragon.
Nothing's ever gonna make me sleep like that again.
And so let's break that down for just half a second. So first of all, you are absolutely positively correct, right? And so every single person that I talk to, night one of Ambien, Restoril, Xanax, it's a love story, okay? It is literally a love story. They're like, and all of a sudden I blinked my eyes and it was 7 hours later and I felt refreshed. Like it's like being reborn, okay? And then you're chasing that forever, right? Yeah. Exactly the same way a heroin addict works. Exactly the same way alcoholics work is you're chasing the dragon, right? You're chasing, for the whole time. And here's what's really, really interesting is that's actually a little bit of a different kind of sleep. And so when we have sleep that's influenced by a medication, it actually changes your sleep architecture somewhat. So it changes your brain's natural ability to go in and out of sleep stages. And that's part of what you're feeling, and it feels really good. At the end of the day, if to be honest with you, if I left you on pills for 30 years, you would sleep and you would be okay, but you wouldn't actually get the same sleep. Like if I put Ryan on pills and Duck on no pills, and I compared and contrasted the two of you, and you both had the exact same amounts of sleep, you would have different amounts of each stage of sleep. And that's, Ryan, where people fall in love with that extra kind of part of the medication. But here's the good news. Is I can take anybody off of meds and I can get almost anybody to sleep. Like, believe it or not, the natural sleep actually is more refreshing than that one. Part of the reason that it felt so refreshing is because you had such shitty sleep before.
Yeah.
Right. So think about it. The deck was stacked right beforehand. You were like, oh my God, it's awful. It's awful. It's awful. And then this doctor gives you this magic pill and you've had crappy sleep for 3-4 years. Right. And now you put all of your emphasis, you're like, this is going to work. This is going to do it. So the placebo effect is in full gear. Right. And then you take it and it actually does something because these things are pretty damn powerful and boom, you're hooked. Right. And so this is the cycle. And so at the end of the day, what I can tell you is in the long run, if I have you sleeping naturally, it's actually physiologically better for you. You will live longer. You will have fewer chronic problems because sleep affects every organ system and every disease state. So believe it or not, while the initial feeling is pretty good of that benzo, the long term of it really isn't sustainable, nor is it healthy, unfortunately.
Yeah, absolutely. That word sustainable, because the other issue you run into is, you take it, benzos, to me, are maybe the most addictive substance on the planet. It's like heroin in that you take a certain amount. Maybe worse, because I saw people coming off of opioids in rehab and people coming off of benzos. The people coming off of benzos were the most insanely miserable people I've ever seen in my life. I was one of them, but I had a very small dependency, but people that were taking like 30 Xanax every day, this type of thing. I mean, literally, they're shaking like a leaf violently throughout the entire day. The entire time they're there, 30, 60, 90 days. Wow. And just the kind of just anxiety. I mean, it's a feeling of doom that I can't even describe when you're coming off that stuff. And what happens though is you get that feeling that you describe, and it's the most restful sleep you ever had. Fast forward a few weeks, it's not giving you that feeling anymore, right? And you need twice as much to get the same sleep, and it never ends. It keeps going up.
And when you escalate in dosage, your body gets used to it or adapts to it. And so what ends up happening is you have more and more. And so then also what happens, and this is very similar to what we see in the world of recovery, is people get clean. Like, let's say you go into rehab and there's no access, so you're tapped out of your benzos, and now you're 30 days without benzos. You get out of rehab, and then you end up taking the dose that you used to take, and you overdose almost immediately. Wow. Right now, here's the good news: is with all of the sleeping pills other than benzos, it's very difficult to actually kill yourself. Like the world's record is, I think, 120 Ambien. Like somebody ate 100. They were trying to kill themselves, but they woke up 3 days later, type of thing. However, with benzodiazepines, they will reduce respiratory drive. They will kill you. Like there's no question about it. Like you can take enough of those, drink some alcohol, and you're done, right? And so you want to be kind of thoughtful and understanding of exactly what's wrong. But back to your point, I have had heroin addicts who have said to me, "You can have my heroin, don't touch my Xanax." It's exactly like what you report, Ryan. And I mean, I know we're spending a lot of time talking about medications and things like that, but at the end of the day, I think the important point here is you don't need a drug to sleep. You don't. Now, are there certain situations where we want to break the cycle of insomnia? Well, maybe that makes intuitive sense to me, right? So let's say you're not the paranoid schizophrenic who has to have the drug, but you're somebody who's miserable, right? And you're only sleeping 3 hours a night. Well, then an Ambien might make sense, because then what we do is we say, fine, you're going to take this every night, starting at this point in time. We're going to get you back to sleeping 6 hours, 6.5 hours. Then we're going to teach you how to sleep using techniques like sleep hygiene, sleep restriction, cognitive behavioral therapy. And then as we slowly get rid of that medication, you get to stay here with your 6.5 hours of sleep and actually do pretty well. The good news is once we get about 3 months in and they're off the medications, we actually get them the best quality sleep. But right in the beginning, it's super hard to get people high quality sleep because you're comparing yourself to synthetic sleep. Right? Like I can't beat Ambien because Ambien works every time, almost exclusively. So I think that's part of what people need to think about. I also think it's probably worthwhile to have a discussion of just a little bit about supplementation. A lot of people like to ask me like, okay, Michael, what's the best supplement for sleep? Like if you don't like medication and you're not a big fan of over-the-counters, because by the way, I'm not a big fan of over-the-counters, and we can talk about that if you want. What about supplementation? Should I be supplementing and does that make sense? So I'm going to let you know my theory on supplementation is one that's a little bit different. So what I feel is everybody should do blood work. Okay. Like figure out what your deficiencies are. Step one. Okay. I can assure you there's nobody out there who has a deficiency in ashwagandha. Okay. They may have a deficiency in vitamin D. They may have a deficiency in magnesium, but I'm pretty sure they don't have one in ashwagandha. Right. And so let's fix the things that this bodily unit needs first, and let's see how it reacts. Dude, honestly, in about 25% of the cases, when I just get people on vitamin D, magnesium, and omegas, I fix their sleep. Like literally 1 in 4 people, that's all I needed to do. And all of a sudden their body, it takes about 3 months, but their body gets into it, reacts. Now we no longer have the deficiency, and the body just works more efficiently,
Ryan,
and allows itself to sleep.
Do you take any of those?
I do. I take all of those.
Oh, okay.
I mean, did you ask me?
Yeah, I asked Ryan if you did.
Yeah.
Oh, yeah. So I did blood work on myself, and I was vitamin D deficient, magnesium deficient, and I was low on omegas. I wasn't deficient, but I was low. And if I'm being honest, at age 57, that's kind of the perfect cocktail for supplementation because so many people are deficient in vitamin D and magnesium and omegas, and all 3 of those really do enough from the exogenous supplementation. So remember, most of the time we want to get these things through food, right? Because magnesium in a rootstock is going to be distributed in your body much better than magnesium in a capsule, right? And so we try to get those from our diets, but a lot of times we can't. And so I would argue that supplementation in those areas makes a lot of sense. The other big one, the other big supplement that I recommend to everybody is water. Like a lot of people don't realize it, but they're dehydrated. The body does not function well when it's dehydrated, and it really doesn't sleep particularly well when it's dehydrated. So I think if you can get your water in, right, and have some regularity to your schedule, believe it or not, this isn't that hard. Like
then
honestly.
I got to pee 3 times a night.
Yeah,
so
exactly.
Great question, right? So when do we stop fluids? When should we consider doing that? So I used to have a rule. This is my used to rule. It has changed. I used to do what I call the 3-2-1 rule, which was 3 hours before bed, you stop alcohol, 2 hours before bed, you stop food, 1 hour before bed, you stop fluids. Okay.
I can do that.
Pretty easy, pretty straightforward to handle, right? So then I started talking with people about it, and I've changed it to a 3-3-3 rule. So everything you should stop roughly 3 hours before bed, especially if you're a guy, because most men who are getting older, I'm 57, we get enlarged prostates, which makes us have to get up in the middle of the night to pee, which can be very disruptive. So if you can get your fluids before about 4:30, 5 o'clock in the afternoon, you're going to be doing well. I mean, clearly have a glass of water with dinner or whatever. But at the end of the day, what you don't want to be doing is having your water bottle next to your bed while you're watching TV to fall asleep, and you're guzzling water, because it's just going to make you have to wake up in the middle of the night to pee.
So fast forward for me to where I'm at now.
Still haven't even finished your problems yet. Jeez, Ryan, come on.
Yeah, well, this is a profound thing for me, and I agree in terms of how important this is, and how, what I want to get to at the end run is, you say you can fix this in 24 hours. Yeah. I want to know what you know that I don't know, because I feel like I've tried everything. That's kind of the point.
Tell me what you tried.
So in rehab, I got on the program of going to sleep early and getting up early, trying to basically the same time every night. And I decided, there's nothing for me after 11 o'clock at night.
Probably
I
not.
don't drink anymore. I don't go out to nightclubs. I don't, and I started looking forward to getting up in the morning and having my morning coffee and being productive. And that's the best time of the day for me. That's why we do all our interviews in the morning. I feel fresh. I feel
much to my chagrin.
Yeah, exactly. We're on different clocks. But what has happened is that whereas I used to have a hard time getting to sleep, now I have a hard time staying asleep. Or when I wake up, I can't get back to sleep. And I've done all the stuff. I've done the no food or drink or no even TV.
This is the number one question that I get asked. Let me guess. You wake up somewhere between 1 and 3 o'clock in the morning, right?
No, actually, it's always about 6 hours. I go to sleep at to sleep at 11. I wake up at 5. I have to pee. And I do a drink because I take my L-theanine and my magnesium and melatonin at night.
How much melatonin do you take?
5 milligrams.
So you're taking 5 times the recommended dose, just FYI.
I was taking 1. It wasn't doing it. Again, not a benzo.
Increasing the dose doesn't change the effectiveness. It just makes you pee it out more. So my guess is you don't need melatonin. Most people don't. Okay. Also, I don't know if you're taking any other medications. Most people don't know melatonin interacts with every antidepressant medication on the market, every birth control on the market, every diabetes medication on the market, and every hypertension medication on the market. So just FYI, especially at that dose, you're changing the effectiveness of other things that could potentially be in your body. Just to let you know, if you could reduce it down to 3, I think you'd probably be better. And it may have an effectiveness on your urination.
Okay. Done. So although I was taking 1 and I was taking 3, and obviously that wasn't working, but the other factors that are important are the peeing factor. I mean, I do have that just 1 couple sips of water, but other than that, I feel like I have a really tiny bladder. I get up at 5 in the morning, and then the other thing that happens is my throat is all dried out because I can't breathe through my nose. So
I can hear it in your voice.
Yeah, it's nasally, right?
Well, I mean, you haven't breathed through your nose on this whole conversation. So what's happening is you're speaking and then you're breathing and then you're speaking and then you're breathing because you can't get anything through your nose.
I went to an ear, nose, and throat guy. He gave me a spray. It didn't really work. It raised my blood pressure. I felt more anxious trying to go to sleep. So I gave up on that. I've been doing the nasal flush. That doesn't really help much. I don't know what the issue is, but I wake up
seasonally. Is it worse during the summer and spring? So
it's pretty much all the time. No, it's pretty much all the time. And I wake up early in the morning. I'm completely dehydrated. My throat is really dry. I chug a bunch of water. I have to pee really bad. I go and I pee. I lay back down. And then I'm half the time I'm exhausted and I'm I have to get back to sleep. And then my mind starts going and I'm then it's hard for me to get back to sleep. The other times I feel awake. I'm I'm ready to start my day. And so I go start my day, but then noon hits and then I have lunch and then I'm I hit the wall. And so I've been building naps into my day. And I've been doing that since I was in grad school because I'm I'm either going to get 6 hours and no nap or I'm going to get 6 hours and a nap. And so when I don't nap, I don't end up, you'd think I'd sleep more, but I don't. it's still the same amount. I have the same problem where I wake up and I have to pee or I am very dehydrated and then I can't get back to sleep. So thankfully I'm privileged to be able to build my own schedule where I have a nap in the day, but some days that works out well. Sometimes it doesn't. Sometimes I can't get that nap. So that's basically where I'm at today.
Okay. So if you were a patient in my clinic, here's where I would go with this. So number 1, no naps. Anybody who has problems with insomnia, who wakes up, shouldn't nap because all you're doing is decreasing sleep drive and making it more difficult for your body to stay asleep. So number one, I would knock out the naps almost immediately. Increasing your sleep deprivation, which pushes you down into sleep faster and makes you stay asleep longer. So there's a very specific reason why you might be waking up, although most people wake up between 1 and 3. So when you go to bed at night, your core body temperature rises till it hits a peak. When it hits that peak, it drops. That drop is a signal to your brain to release melatonin, okay? Your core body temperature continues to drop. At some point in time, it has to go north. Otherwise, your body goes hypothermic and you die, right? Guess what time that usually is? Between 1 and 3 o'clock in the morning. Okay. So every single human on Earth, you probably actually do this as well, wakes up somewhere between 1 and 3 o'clock in the morning. However, most people burp, fart, roll over, and go back to sleep. Okay. For whatever reason, at 5 or roughly 6 hours after you wake up, your body doesn't seem to want to do that. My recommendation would be, if you wake up at 5, if you wake up within 45 minutes of what you would normally wake up, get out of bed and start your day. Don't nap at all during the day, and go to bed at your normal bedtime. The biggest problem that most insomniacs do is they go to bed early because they're like, oh shit, I'm really tired. If I hop in bed, then maybe I'll catch up on my sleep and be able to get enough sleep. So sleep doesn't work that way. Sleep is more like a baseball game, right? It has a particular start time. It has a particular end time. If you happen to show up at different times, you'll get different results. So just like a baseball game, if you show up too early, you're pretty much going to watch batting practice, right? You don't get to see the game, right? Game doesn't start till 8 o'clock, right? Bedtime or lights out or whatever your personal time is, by the way, that's set by your genetics. So if you're a dolphin, we could actually look on your human genome and figure out exactly what time you should be going to bed. My guess is it's probably later than what you are currently doing, because you were a night owl, or what I called a wolf, for most of your adult life. My guess is also a lot of my people in recovery are also seem to be night owls. My guess is that you're probably actually on that night owl schedule genetically, but it feels pretty good for you to wake up early in the morning, and you've been able to kind of work that through your schedule. So what I would do is I would pick a wake up time for you. What time do you wake up normally?
Usually about 5 or 6 in the morning.
Okay. Is there a particular time?
Well, it depends on when I actually got to sleep and how. I mean, every now and then I'll get 7 hours and I'll sleep till 6. I usually go to sleep around 11.
Is it variable in terms of your wake up time? You can get up basically whenever you want, or do you set an alarm?
No. Here's the thing. If I stay up late, like if I am out having fun with friends, whatever, and I don't get home till midnight and I don't get to bed till 1 or 2, I wake up at the same time. I have no ability to sleep in. So if I go to sleep at 10, I might get more sleep sometimes. But if I go to sleep later, I still wake up at the same time.
And that time is roughly 5:45?
Yeah, it's around 6. Yeah, something like that. Yeah.
So let's peg it at 6, right? So what I would say if you came into my clinic is I would say, okay, your wake up time is 6 a.m., period, full stop. If you get up early, if you get up within 45 minutes of that, so if you get up anywhere between 5:15 and 6, I want you out of bed. No naps during the day. I want you going to bed, I would say, at 11:30. How long does it usually take you to fall asleep?
It's quick because I'm always exhausted.
Yeah.
So I hit the pillow, I'm out.
Yeah. So to be fair, if you were in my clinic, I'd actually probably have you stay up until midnight, and I'd have you go from midnight to 6. And I would really make you exhausted. Like, I would bring your natural sleep deprivation up so high that not only would you fall asleep, but you would stay asleep, and you would move past that awakening that is waking you up. I'd also probably restrict your fluids 3 hours before bed. That way you're not waking up in the morning and feeling like you're going to die because you need to pee. So I might 3 hours before bed, set an alarm, stop fluids, right? I don't really care what time you go to bed, as long as it's not earlier than probably 11:30. And then I would have you getting out of bed at 6 a.m., right? So giving yourself a period of time of roughly 6.5 hours of sleep in bed. The technique is called sleep restriction. It's very well documented. It's been used for 20 years. I use it frequently with my patients. It really should only be used by people who know what they're doing, because if you kind of do it on your own, you can kind of screw yourself up, which we don't want to do. But the bottom line is I'd give you a 6.5 hour window of opportunity for sleep. And then I would do that for 10 to 14 days, right? So by day 10, you're furious. You're exhausted. You're calling me Dr. Evil. You are not happy with Michael Breus in any way, shape, or form. However, what we end up doing is breaking that cycle of insomnia. So what we're instead of breaking it with a drug and forcing you to sleep, we break it with forcing you to stay awake and sleep deprivation. And it's much easier when we do it this way because then your body reacts better to it. So right around day 10, you are hating me. But around day 12 or 14, you really turn that corner and all of a sudden you fall asleep and you stay asleep until the alarm. Once I get you sleeping that 6.5 hours with no awakening, then I can slowly, by about 15 minutes each week, I can bring it out a little more, and get you a little bit more sleep. But it takes me a while to get you there. The whole process usually takes about 6 weeks. So that's usually how quickly I do it. When I change somebody's life in 24 hours, generally speaking, the reason that happens is because I've identified, for example, obstructive sleep apnea that hasn't been diagnosed before, or narcolepsy that hasn't been diagnosed before. We can get them on meds literally in 24 hours. We can get them a CPAP machine literally in 24 hours. So that's really where the speed comes in. Insomnia takes a little while to start up, so it takes me a little while to fix it. But I will be clear, there's nobody on earth who can't sleep. Like, just to be very, very clear, like there's literally no person on earth who can't sleep. There is a disorder called fatal familial insomnia. There's one family in Italy that has this weird gene where at around age 25 or 30, a tumor forms in their brain in the sleep center and keeps them awake, and they just basically stay awake until they go crazy, and then they die by like mid-40s or something crazy like that. I can't count the number of patients who have told me that they are pretty convinced that they have fatal familial insomnia. And again, it comes from one Italian family. So these people are like, from someplace else, so like there's no universe they have any Italian genes. So I think what happens is people look at their sleep situation and it's easy to catastrophize. It's easy to make it bigger than it is. In the middle of the night, let's get back to your insomnia. And so what would we do for it? So number one, I would restrict your sleep, but you're going to wake up anyway. And so there's several different things that I would do for you if you woke up. And just for everybody to know, the most popular video I've ever done on YouTube is it re-explains what I'm about to explain. So if people swing on over to thesleepdoctor.com and want to look at my number one video on there, it talks about how to fall back to sleep. That's what I'm going to go over right now. So when you wake up, there's a couple different rules that I'd like you to follow. So number one, don't go pee. Now, Ryan, you're going to not like this rule. I know that you're already told me that your bladder is small bladder. And all. Yeah. Your hamster bladder, exactly. But here's the reason that I say this, and I'm not really telling people not to go pee, but what I am telling people is don't go pee unless you actually need to. So what happens to a lot of people is they wake up, it's 3 o'clock in the morning, and you know what they do? They say, I'm up, I might as well go pee, right? Here's the metric that's most important is you need a heart rate of 60 or below to enter into a state of unconsciousness. Okay, that is the biological fact. So when you go from a lying position to a seated position to a standing position, you walk across the room, guess what happens to your heart rate? It goes above 60. And so when you get back from the bathroom, now you have 2. And by the way, if you pee standing up, your heart rate goes up even more. So guess what? Now your job is to get your heart rate back. So if you don't actually have to go pee, don't go pee. Now, also the other thing is most people are side sleepers. And when you're a side sleeper, you sleep kind of squunched up, which squunches your bladder. So if you just turn to your back and you count to 10, you might realize that you actually don't have to pee, right? It was just that the position you were in was pushing on your bladder and makes it easier. Because again, when you go from lying to sitting to standing, you got a whole nother issue going on. The second thing that people do is they look at the clock, right? Don't look at the clock. Why? Because you instantly do the mental math and now you're pissed off, right? It's 3 o'clock in the morning. I've been here every single night this week. This sucks. Sleep, right? And you try to force yourself to sleep. Dude, in the history of time, nobody has ever forced themselves to sleep. Your energy's going in the wrong direction, right? I would argue that sleep is honestly energy transfer, right? So it's going from your energy in the daytime. You have to change that form of energy into more of a nighttime energy, more of a parasympathetic energy. So daytime energy, I think of as sympathetic energy, fight or flight, get shit done, productivity. Evening energy, more parasympathetic, more rest and digest energy, right? So trying to push yourself into that is kind of the opposite of what that is. So it doesn't really work, right? So what do I do, Michael? Let's say I had to go to the bathroom, so I went, but I didn't look at the clock. Now I'm kind of sitting here and I'm getting monkey mind, because that is the number one thing that people get is monkey mind in the middle of the night. So my favorite technique, what is monkey mind? Well, Ryan, what's monkey mind? You tell me. I guarantee you know the answer to this.
I don't know the answer to this.
Really? So what do you think about in the middle of the night?
What do I think in the middle of the night when I wake up after 6 hours? Mm-hmm. I start thinking about what I have to do that day. I start thinking about
monkey mind. That's monkey mind, okay. Right?
Okay.
It's all the shit that starts going. It's you click into your day. You start thinking about something, and now you're on a roll. It's not like you're saying to yourself, "I need to answer this one question." It's like, what do I have to do tomorrow? What did I do yesterday? Did I say that right? That's monkey mind. Guess what that does? It increases your heart rate. Mm-hmm. Okay. Bottom line, like all I care about is lowering your heart rate, right? So what do I want you to do? 4-7-8 breathing. Are you guys familiar with this technique? Mm-hmm. So believe it or not, you can do it in the middle of the night. And if you do it in the middle of the night and you do it nice and slow, you lower your heart rate below 60. So 4-7-8 breathing was developed by Dr. Andrew Weil, not me, very famous Harvard-trained natural doctor, super smarty, very cool dude, came up with this thing for the Navy SEALs. So it's exactly what it sounds like. You slowly breathe in through your nose for a count of 4. And by the way, you should envision the number counting down. So your eyes would be closed. And as you're breathing in, you envision a 4, then a 3, then a 2, then a 1. Then you hold and you envision a 7, a 6, a 5, go all the way down. And then when you push out gently through your mouth, you envision an 8, 7, 6, 5, 4, 3, 2, 1. Okay. Now, that's how you do it. Now, I'm going to give you the hacks as to how to do it easily, because there's nothing easy about 4-7-8 breathing. So I tried to do it and I couldn't hold for 7, and I certainly couldn't push for 8. So I did 4-5-6 breathing to start out with, because I was getting anxious in the middle of the night doing the breathing technique. That's not helpful, right? So I said, I'm just going to change it. So I breathe in for a count of 4, I hold for a count of 5, I breathe out for a count of 6. And then I slowly worked my way up to 4-7-8. So that was trick number 1. Trick number 2, you need 20 cycles of this to drop your heart rate to 60. If you're doing this, how do you count to 20 while you're counting and envisioning 4, 7, 8? It's really hard to do. And you get pissed off when you miscount, and then it causes anxiety. So I lie in bed and I take my hands and I make gentle fists like this, and I put it down by my side like this. And then when I go through 1, I just stick out a finger. And then when I do another 4, 7, 8, I stick out a finger. Before I'm done, I've got 10 fingers out and I wrap them back. I'm at 20 cycles, and I usually never make it back to 20. Like I almost never make it back to 20 because I'm in the breath, right? I'm envisioning the number. And what is this? So what is this doing? It's doing 2 things at the same time. It distracts me from these anxious thoughts, monkey mind, but it also kicks in the parasympathetic nervous system. By doing this pattern breathing, it actually increases that and lowers my parasympathetic or my sympathetic nervous system, which allows me to become more relaxed, lowers my heart rate, right? So we've got something that distracts my brain and lowers my heart rate at the same time that I can do in the middle of the night after I peed if I had to, or if I didn't have to, then stay in bed. So that's one of the techniques that I would have you do, Ryan, if you woke up at 5 o'clock in the morning, is I would have you do that. There's another couple of techniques that I would want to talk about. The second one is called Yoga Nidra, right? So you've probably already heard of Yoga Nidra, which is basically lying kind of in a corpse pose, quiet. Here's what's interesting. In the science world, we call Yoga Nidra non-sleep deep rest. Fancy, right? But here's what it is. It's Yoga Nidra. You're lying there in the dark with your eyes closed. Guess what? Turns out it's rejuvenative. It's not the same as sleep, but if you do that for an hour, it's worth about 20 minutes of sleep. So if Ryan, if you just laid there for an hour without getting pissed off, you'd still be getting yourself some level of rejuvenation. So that's important to know. The final one is acceptance, right? It's not like you haven't been here before. And by the way, your head didn't explode, right? Your world didn't come to an end. However, in the middle of the night, you're pretty sure it will. Yeah. Right. And so when it's the middle of the night, when it's 3 o'clock in the morning and I can't fall back asleep, because this has happened to me as well, what happens is negative thoughts proliferate my brain in the middle of the night. Why? Because my brain is saying, why the f are you awake, Michael? It's not happy being awake. So it's automatically going to evaluate everything negatively. So what you have to do is when you wake up is you have to put a spin on it. You have to change from this negative thought process to a positive one. So here's what I say to myself. Oh, I guess my body wants to be up right now. Well, that's okay. You know what I'm going to do? I'm going to practice my meditation, or I'm going to practice my 4-7-8 breathing, because my body is giving me an opportunity to do this. Not, here we are again, right? Yeah. Oh, gosh darn it, I'm pissed off. None of that is helpful. But just relaxing a little bit to say, hey, I'm going to trust my body. Like, my brain may not understand why I'm awake, but my body does. I'm just going to trust my body and let my body do its thing and relax. This is what I call the sleep mindset, right? So when you're awake, you have a wake mindset, but you've got to figure out, this is that energy transfer I was talking about earlier, is you've got to figure out a way to change your mindset into more positivity, because once you do, sleep gets much easier.
A little parallel to, accepting the things you can't control. And,
It's the serenity prayer. Are you kidding me? Like, come on. It's right? God, grant me the serenity to accept the things I can't. What is it? I accept the things I can't change, courage to change the things I can, and the wisdom to know the difference. You really can't control this. So stop trying. Just accept it. And guess what? It goes away.
So the big challenge for me, because I'm with you, and I love the idea that, between sleep restriction and the hours and not napping and limiting the things that might be actually causing sleep to be more difficult, right? Whether it's supplements or medications or caffeine, all of these things that in time, even though it's going to suck at first, right, that over 12 or 14 days, you give an actual number, like things will start to improve where you're actually getting better quality sleep for those 6 hours, and then hopefully it starts to extend. I love the idea of that, and I want to feel like it's possible, even though I've gotten maybe a month or two down the road on like a program like that, and then just gotten so frustrated where I end up getting into bad habits again. The challenge for me, and I think probably people are asking this question, is like, for me as an addict, like when I was at my wit's end in terms of alcohol and to a certain extent medications, I needed to be in an environment that was heavily restricted in order to get out of that cycle. And I know that these things are not to that level, and that's kind of part of the reason why they're hard to change, is because the motivation is not as strong. It's like they're not killing me. So then, like, when I get to day 3 of not napping, if I get to day 3 of no caffeine, of whatever it is that I'm changing that is supposed to be an improvement, but in the short term is making things harder, and then I'm in the middle of work, or I'm in the middle of a social situation that normally I would enjoy, but now I'm feeling really grumpy and negative, and my appreciation of life is going down, and my ability to function at the level that I like, things that you're describing, like being more positive, having acceptance, not being anxious, become more and more difficult.
Correct.
And then it gets to a certain point where I'm depressed, I'm on edge, I'm not thinking clearly, and so maintaining those things becomes more of a challenge. And I feel it's like if I could go away for a month and do this all in a place where it was like very controlled and restricted, like rehab, maybe I would have an easier chance of getting into the routine and improving in the way that it does. How do you do that in the midst of your life? How do you do that when you have work and when you have kids and you're trying to get everything done and you have to be going through withdrawal or going through sleep deprivation? Like, how do you do that?
There's a couple of different steps. So first of all, you don't do it by yourself, right? And so you doing it by yourself, you're completely depending upon your own willpower, which is very difficult to do, especially when you're sleep depriving yourself. So as you're depriving yourself, your willpower is wearing away quicker and quicker. So having somebody like me to be an accountability partner becomes very, very important. So number one, don't do it on your own. Number two, educate everybody who you're coming into contact with what you are doing. So your bed partner, your family member, your boss, your coworkers, let everybody know, because number one, you're going to want their support. Number two, you're going to want their acceptance, because you're going to be an and you want them to know why you're doing that. Right. And so you just want to say, hey, here's the good news. It's not like you're saying I've got some major, embarrassing problem. You're saying, hey, I'm trying to work on my sleep, and I'm working on this technique, which is going to make me restrict my sleep for a short period of time. I know it sounds like torture, but I'm going to do it anyway. So I'm probably not going to be in the best mood over the course of the next 2 weeks. Can you do me a favor and cut me some slack? I've never heard anybody say no. Never. Right? So people, and by the way, here's what will happen is the people that you tell, they will start rooting for you, and they will start asking you, and they'll be like, hey, how's it going? And then now you get to talk about what's happening with you, and it becomes more acceptable, and you're starting to learn more. And by the way, you may teach them something that they didn't know, because by the way, they probably have the same sleep issue that you do, but they don't know of a resource yet by which to do something like this. So enlist as many people in your life as you can. Also, give yourself a break. You don't have to be perfect at this, okay? Like, nobody is perfect at this. It takes time. That's why it takes 6 to 8 weeks for people to do this, right? Is because, maybe 5 out of 7 nights you woke up or mornings you woke up at the right time. Okay, next week let's move it to 6. Next week let's move it to 7. So there's a time, but you definitely need an accountability partner or a coach that can kind of work with you on this, because right around this 2-week mark, almost everybody wants to quit, because it's just hard, right? It's just not easy. You're really battling against yourself. You're basically breaking your body down to then recreate this new scheduled environment for yourself. And it's just not an easy thing to do. The other big thing that I tell people to watch out for is during that period of time, don't overextend on or over-index on anything. Like, don't start a new diet, don't start a new workout program, don't decide that you're now interested in coffee, and you're going to try 12 coffee shops this week. You know what I'm saying? Like, that is not the time to start any new behaviors, because it just complicates, right, the situation, right? And so when you can line yourself up doing these things and get the support of people around you, it's a lot easier than it looks. And sometimes you can lean on those people to help you out. Like, as an example, one of the things that I have a lot of my patients do is they have a hard time staying up late. So this sounds very counterintuitive, but it's like they're so used to going to bed at 10 and then waking up at 3 and not being able to return to sleep. When I tell them to go to bed at 12, they don't know what to do with themselves. So we enlist the bed partner, and then we say, okay, well, what's a favorite game? Like, is there a card game? Like, do you guys like to play spades or hearts or gin, or like, do you like cribbage? Like, what do you like to do at night? Like, can you spend time? And then what we do is we find these carve outs of goodies that make you want to continue. So as an example, when we stabilize your wake up time, so let's say your wake up time is 6 a.m. When we stabilize that, let's say previously it was kind of wonky and was all over the place. Once we stabilize it, now you have an hour in the morning that you might not have had before, that you can do something with, that you can actually have productive work with, right? And so I feel like that becomes important. I want to read you something that kind of cool. You know who James Clear is? The Atomic Habits guy?
No.
So there's a book called Atomic Habits. It was very, very popular for a period of time. And he's this guy he's just got a really interesting perspective on things. He said something about sleep. I'd like to read a quote that I think is relevant to what we're talking about here. He says, "I'm usually asleep from 5 a.m. to 6 a.m., but when I wake up early, I tend to enjoy it. Start the day slow, watch the sun rise, get a few things done before everyone else wakes up. Meanwhile, I'm often awake from 10 p.m. to 11 p.m., and I find that I tend to use this time poorly, passively watching TV, scrolling on a screen, late night snacking, overthinking things that are unimportant. If I could just trade the last hour of the night for the first hour in the morning, that would be a very high value trade for me. And so the question becomes, which hours of your day tend to return the most value and which tend to return the least?" And it's kind of an interesting thought, right? Mm-hmm. If I could stop around at night, right? get myself up on a regular schedule in the morning time. It gives me an extra time for me to do something for me, not watching something that probably has no real influence on me. Maybe it's reading something spiritual. Maybe it's getting an affirmation. Maybe it's doing push-ups. Maybe it's going for a walk with your dog. I don't think I care, but I like the idea of having some time for yourself in the morning time. And I think that's one of the things that sleep can allow you to do, is to give you some of that space that so many of us really kind of need.
Yeah. And Ryan, I'm glad that now I finally have something I can do. I can come over and play cards with you at 11:30 at night, because I still got 3 or 4 more hours. Dr. Breus, I want to respect your time and get you out of here, but real quick, I wanted to kind of bring it back around to the mental health connection, with a quick anecdotal example of something that I went through, and then I have a speed round of questions for you that I want to rattle off, and I want you to answer them just really quickly. So
I'm a chatter, so it might take a while.
Okay, so my own sleep issues. By the way, I was a bear, which I didn't agree with. I thought I'm a wolf. I'm a guy that stays up till 3 a.m. every night. But anyway, we can talk about that another time.
You could be a late bear, by the way.
Interesting.
They're hybrids.
I think we talked about it a little bit before in the intro, that I love to stay up late because I didn't want to miss anything that was happening. I always wanted to be the last guy to go to bed. But I also think that there's a connection. Listeners of this show know that I have long had a phobia of vomiting, of throwing up. I haven't thrown up in 40 years. But some of the last times I ever threw up was in the middle of the night. I woke up in bed, threw up all the side of my bed, probably around 3:45. I think there's a big part of that makes me, if I stay up until 3 a.m., I'm going to sleep through the scary 3:45 time. The next time I open my eyes, the sun's going to be out. It's not as scary to be feeling sick in the sun in the daylight. So I think it's an obvious kind of connection to the psychological hurdles that can impede sleep as well.
Absolutely.
So now here's my speed round for you. Just tell me kind of your quick thoughts on these. You said sleep affects all these systems. When I don't get enough sleep, my stomach is very upset. I wake up and I have to go to the bathroom, and it's not pretty. Is that an obvious? I mean, is there an obvious one-to-one connection there?
So there is, and so one of the things that we know is that when you are having belly pain for whatever reason, whether it's food poisoning, indigestion, upset microbiome, what have you, while you're asleep, your brain notices that, and it actually pulls you out of the deeper stages of sleep and into the lighter stages of sleep to basically divert energy and to allow for that process to continue to occur. So it's not surprising that if you do have some level of stomach upset, that it does wake you up and makes you go
so
to
it
bed.
isn't necessarily the lack of sleep that's upsetting my stomach. It's the fact that my stomach is upset and it's waking me up.
I would argue that's probably it. However, what I will also tell you is when people are sleep deprived, they can get some level of stomach upset, usually because they don't have enough food in their belly.
Gotcha.
Because they're up, and so their body's looking for resources.
Interesting. You answered my next one pretty clearly. The difference between, if I'm not sleeping, is there still benefit to at least resting with my eyes closed?
Absolutely.
Breathing? I can still get regenerative help. Excellent. Let me just mouth tape from nose sleepers.
Oh, yeah.
It's a big
Let's
thing
talk
right
about
now.
mouth
Real
tape.
quick, what are your thoughts on it? Is it quackdom or is it an actual thing?
It is a terrible, terrible idea.
Good to know.
So there is a study that just came out that reviewed 18 different studies looking at mouth tape. So this is what's called a meta-analysis. So this is where you go across multiple studies, you review statistical techniques, you basically answer the question, yes or no, is this a good idea, is this a bad idea? We've got 18 studies, 17 studies, whatever.
And for our listeners who may not be aware, it's a phenomenon where people literally tape their mouth shut to influence breathing through your nose more while you sleep.
That is correct. So, for example, Ryan, who has a clogged nose at all times, might consider trying this to force his brain to breathe through his nose. Now, to be honest with you, that would be a terrible idea for Ryan, because if he did this, he can't breathe through his nose to save his life. And so he would be waking up like this all night long, right? So here's what we know is mouth tape is a bad idea, generally speaking, but it's even worse for people with undiagnosed sleep apnea. Okay. So because what happens is when you tape your mouth, you don't know that you're having the symptoms, and the disease gets worse and worse. And so many people will tape their mouth shut and wake up and feel better because they haven't been sleeping with their mouth open all night long. They'll say they feel refreshed, and they may actually have gotten a little bit better sleep. However, if they do have undiagnosed sleep apnea, it's getting worse and worse and worse behind the scenes. So what I tell everybody is, if you want to use mouth tape, feel free, get a sleep test first.
Gotcha.
Right. And by the way, sleep tests now are super easy to get. If you swing on over to my website, thesleepdoctor.com/Dr. Mike, you can click on a button. I can literally have a sleep test delivered to your door for less than $200. Like full nonstop medical device. I can tell you if you've got apnea in one night. Like it used to take us 7 or 8 weeks to get people into a lab, attach 27 electrodes to them, like do all the craziness that was going on there. Now, literally push a button, send it to your house, put something on your wrist, wake up the next day, meet with my guys on Zoom, and you've got a diagnosis.
Ryan,
it's impressive.
Get it done. Let's do it.
I did that.
Okay. All right.
I do not have sleep apnea according to that test.
Yeah. That doesn't surprise me.
All right, 2 last questions, and then we'll let you go. When I wake up completely drenched in sweat and my pillow's drenched in sweat, did I have a bad dream? Am I reacting to the temperature? What's happening? Why does that happen?
So the first question is, were you drinking alcohol?
No.
So generally speaking, what ends up happening with a lot of people is there's 2 effects of alcohol. First, alcohol has a thermogenic effect, which makes your body really, really warm. And then it has the opposite and makes your body really cold. So a lot of people will get super duper sweaty in the middle of the night if they've been drinking themselves to sleep. So number 1, glad to hear that you're not using alcohol to help you sleep. Number 2, another reason why you could be getting sweating is, remember when we were talking about that turn of your core body temperature? So that could be kicking into gear, which is definitely causing a level of sweating. My first reaction is I would change your bedding. I would look at your comforter, and I would use a summer comforter if you have one.
It isn't a thing where I wake up sweating. I'm talking like when you wake up and you're like, what the heck happened? Like your shirt is stuck to you, and you obviously have some sort of body reaction where you are drenched in sweat. And that doesn't happen often, but when it does, I'm always very confused.
So generally speaking, my guess would be that it is just a thermogenic reaction to something, right? So that could be a large meal that you had too close to bedtime. It could be, like we were saying before, alcohol. It could be the environment. Your room is warm. You maybe the sheets have polyester in them, which has a tendency to trap heat. Maybe your bed's got memory foam, which also has a tendency to trap heat. So sometimes those things could be at least possibilities. But it feels like it's something that is external that is causing something internal to kind of happen there. But night sweats also, by the way, sometimes people just get them for no reason. And believe it or not, there's even a medication that you can now take that can lower night sweats because they're trying to fix night sweats in women with menopausal hot flashes.
Yeah. It's not a chronic condition, but if it happens, I've always been curious. Okay, my last question, and it's maybe it's a little embarrassing, but I want to know about it. Gentlemen wake up in the morning with a certain stiff erection. What's the science behind that? Is it just that I have to pee and my bladder's pressing on? And how does that happen?
No, it's not. So actually, your testosterone is at the highest point when you wake up in the morning, and that's arguably why most men awaken with an erection. And as a matter of fact, if you ever end up going to a urologist, it's one of the first questions that the urologist is going to ask you is do you wake up with a hard-on? And if you do, that tells them a certain amount based on your age and your medical history. That will tell them quite a bit about things like your prostate, the strength of your erections, things of that nature.
Gotcha.
And so I would also argue, so my most famous book is called The Power of When, W-H-E-N, where you learn about these chronotypes, this quiz that we've been talking about. And the most read chapter in that book is when is the best time for sex. So why don't we talk about it real quick? And so most people have sex between 10:30 and 11:30 at night, and their hormone profile looks terrible, right? So they're low in testosterone, estrogen, progesterone, cortisol, and adrenaline, and they're high in melatonin. That's at night, right? What do you think your hormone profile needs to look like if you want to have sex?
The opposite.
Literally the opposite, right? You want your melatonin to be low, and you want all those other things to be high. Well, we know that naturally occurs in the morning, and we know that most men wake up in the morning with an erection. If that's not Mother Nature telling you when to use that thing, I don't know what is, okay? So at the end of it all, I think that also, by the way, we did a study where we looked at morning sex versus evening sex based on your chronotype, and what we discovered was that different chronotypes reacted differently. But when we just looked across the board of women versus men, when we looked at women reported morning sex, they had a better emotional connection to their partner. Men reported that they had greater erectile function with their partner. So there's a couple of decent reasons why, like you heard it here from the sleep doctor. Everybody should try to have sex in the morning and see what happens. Do me a favor, hop out of bed, throw in a little mouthwash, then hop back into bed or brush your teeth, and then check it out, see what happens.
A perfect way to finish the speed round and a perfect way to finish the episode. Go have morning sex. Sounds good to me.
Go have morning sex, exactly.
Excellent. Well, Dr. Breus, thank you so much. We want to know, you have books out. Is there anything you want to promote before we sign off? Yeah.
So if people want to do a sleep test, that's probably the biggest thing. thesleepdoctor.com/Dr. Mike, just DRMIKE. My YouTube channel has got all kinds of great information. We've got over 900 videos on there. So my YouTube channel is just The Sleep Doctor. So feel free to swing on by and check it all out. Also, I'm on all the social platforms. We do different stuff on different ones. So TikTok is different than Instagram. It's different than Facebook.
Excellent. Well, thank you so much, Dr. Breus. This has been a very enlightening conversation and hopefully helpful. I'm going to try to apply the things that you have told me it will work and see how far I get before I'm calling you on the phone begging for an appointment.
So here's what we'll do is I want you to try it out. And then if you do want to do that, why don't we work together and then I'll come back on the show and we can talk about how we work together and what worked for you and what didn't, because I'm not perfect every time, but I think your listeners would probably like to know.
That would be amazing.
And I'm going to force my wife to listen to the last bit of the speed round, so maybe we can apply some of the lessons.
There you go.
Just some activities.
Tell her the sleep doctor knows what he's talking about.
He's a doctor, honey. We have to
I'm
listen
a doctor,
to
for God's sake.
Prescribed it.
Absolutely. All right, guys. Thanks again.
Thank you so much. All right. Our guest this week on the Harder to Breathe podcast has been Dr. Michael Breus, the sleep doctor. Join us every Tuesday for new episodes. We'll see you next week right here on the Harder to Breathe podcast.
Go get some sleep.
Sweet dreams.